Hello my friends, my name is Dr. Said Kazmi, watching my YouTube channel. Let's talk about cryoglobulinemia. Now, cryoglobulinemia. Cryo means cold, globulins mean immunoglobulins, and emia means increase in the blood. So cryoglobulinemia is a condition in which there is an increase of immunoglobulins in the blood. And why we call it cryo? Because these immunoglobulins are very peculiar in nature, that they precipitate when the blood temperature is low. Or in other words, even when the environmental temperature is low, there is a tendency for these immunoglobulins to clump together, which we call as precipitation, and they precipitate. So when they precipitate, they can create problems because they can increase the viscosity of the bloods. They can get deposited in various tissues. They can activate the complement system, which can then lead to activation of the inflammatory cascade, and that can produce a lot of symptoms for the patient. So, immunoglobulins basically are created from the beta lymphocytes, and they have got a specific role to play in the body. And that is that they help you in fighting different types of bacterial and viral infections. Now, there are 5 types of immunoglobulins: immunoglobulin A, immunoglobulin D, immunoglobulin G, immunoglobulin M, and immunoglobulin E. And any one of them can increase in the blood because of various reasons. And it can be a single, what you call chain increase in the blood, which we call as monoclonal gammopathy, or monoclonal increase in immunoglobulins, or it could be polyclonal, where there is more than one type of immunoglobulin that has increased in the blood. We will talk about that in a moment. Let's start with a clinical case. Now, let's say a 10-year-old boy, he presented with a sudden onset of non-blinding rash on his lower legs, and that rash is slightly painful. He also been reporting joint pain in the last couple of days. 3 days ago, he said that he had an acute onset of non-traumatic left-sided knee pain. The knee joint became swollen. It was very painful to the extent that he couldn't even move. He was crying, but for some reason that has resolved on its own. Now, the boy has got more of a dull, aching pain, and he says he's got weakness in his legs as well. And as I told you earlier, that he's got a rash on his lower limbs and probably to some extent on his left wrist as well. So when you examine him, you find out that he has a painful. This rash is tender. It's pinkish purplish in color. It's macular in morphology, and it's present on the both lower limbs, and it's also present on the left wrist as well. So you think that there might be some inflammatory condition going on, or there might be a possibility of HSP. So what you do, you try to look further into these things, and you try to do some blood tests, and to your astonishment, the full blood count comes out to be normal. His C-reactive protein is normal, his LFTs is all normal, his coag profile is normal, his ESR is normal, and you do your urine analysis is also normal. And now you're scratching your head. What is this condition? Why this child had sudden onset of knee joint pain? It got swollen, it has resolved, and now he's got this tender purpuric rash on his body. So this could be cryoglobulinemia. Why? Because I told you earlier that cryoglobulinemia means that there is precipitation of immunoglobulins due to low temperature in the blood, and these immunoglobulins can get deposited in different organs like skin, like joints, and then they can activate the inflammatory cascade. Now the question is, why would immunoglobulins increase in blood, and what are the different types of cryoglobulinemia? So let's talk about that. Now, there are 3 types of cryoglobulinemia: type 1, type 2, and type 3. We also call type 1 as monoclonal and type 2 and 3 as mixed. So what does type 1 or monoclonal means? Monoclonal means that there is an increase in immunoglobulins in the blood, but these are monoclonal. So they are derived from a single clone. That it could be IgG, it could be IgM, it could be any other type of immuno, but they are all belonging to the same clone. That if it is immunoglobulinemia M, then all the immunoglobulins would be of M type. The type 2 and type 3 are mixed. In other words, in this, the immunoglobulins are increased in the blood, but they are of different clones. It might be a combination of IgG and IgM, or IgM and IgA, or any type of combination that you can think of. Now the question is, Where do these immunoglobulins come from? Why they've increased in the blood, and why there is a tendency to precipitate when the temperature is low. Now, these immunoglobulins are not normal immunoglobulins. They are abnormal immunoglobulins. Now, normal immunoglobulins actually help you in fighting off different viruses and bacteria, but these ones are not helping you. They are actually your foes. So the type 1 is usually associated with plasma cell disorders. For example, it can happen in multiple myeloma, where you've got the special type of proteins, immunoglobulins, Bence-Jones proteins, or it can also happen in a condition which is known as Waldenstrom's macroglobulinemia. Now, type 2 and type 3, they are mostly caused by what we call as different types of chronic infections. Especially notorious in this category is hepatitis C. It can also occur in hepatitis B, but hepatitis C is notorious and known worldwide for causing cryoglobulinemia of mixed type in certain cases where the infection is chronic, especially in chronic active hepatitis or even in chronic persistent hepatitis. Some of the autoimmune disorders like SLE, like rheumatoid arthritis, they can also be associated with cryoglobulinemia. Who knows? And subtype of lymphoproliferative disorders in which there is proliferation of the lymphoid tissue. Different types of lymphomas, different types of leukemias, they can give rise to a condition which is known as immunoglobulinemia, hyperimmunoglobulinemia, and that can become a cryoimmunoglobulinemia. So cryoglobulinemia is of three types: type 1, type 2, type 3. Type 1 is monoclonal, type 2 and type 3 is polyclonal or mixed. Now, remember, we also classify cryoglobulinemia by the symptomatic or asymptomatic. Now, cryoglobulins might be present in a patient, but they do not always cause symptoms. So the presence of cryoglobulins does not mean that the patient has got the symptomatic cryoglobulinemia, because in many of the cases, cryoglobulins will be present because of that chronic active hepatitis C or chronic hepatitis B, but they do not cause any symptoms. But in 50% of the patient, it can be symptomatic as well, in which it starts producing symptoms. So when it starts producing symptoms, it means that the immunoglobulins are now precipitating because of low temperature, and not only they precipitating, they are causing an activation of the inflammatory cascade, and that leads to problem, because wherever this inflammation would occur, whether it's in the joints, whether it's in the kidneys, whether it's the skin, whether it's any other organ, it's going to create problem. Now, usually in symptomatic cryoglobulinemia, remember 4 organs where these immunoglobulins can precipitate and can cause symptoms. So most commonly you would see that the skin is involved. So when the skin is involved, what happens? These immunoglobulins, because skin is the largest organ of the body, it is the one that is usually exposed to low temperature. So usually if the temperature is low, the immunoglobulins have got a tendency to precipitate in the skin tissue. So it's going to cause precipitation and can cause inflammation in the skin in the form of Raynaud's phenomena. It can cause livedo reticularis, or it can cause leukocytoclastic vasculitis, which is more of a HSP like rash, which can occur on any part of the body. But it can frequently affect the lower limbs and can be confused with Raynaud's purpura. So in skin, it can cause vasculitis, which is inflammation of the vessels in the skin, and can cause tender, painful, non-blanching rash, as we saw in the case that we discussed earlier. So that was because the immunoglobulin had precipitated and had deposited in the skin tissue. It can also get deposited in the nerves, and if you get deposited in the nerves, it's going to cause peripheral neuropathy, especially mononeuritis multiplex. So it can cause a nerve to be affected here and a nerve to be affected here, giving you weird type of neurological symptomatology, like numbness in different parts of the body, weakness in different part of the body, maybe hyperesthesia in certain conditions. So that weird type of symptomatology can happen because of cryoglobulinemia. It can also get deposited in the kidneys, where it would cause glomerulonephritis, and that can lead to hematuria, that can lead to proteinuria. And if the kidney is involved, then we have to treat it, because kidneys are an important organ of the body, and if kidneys are involved, then it can lead to an acute kidney injury or a chronic kidney injury, which can have long-term consequences for the patient. And last but not the least, these immunoglobulins can get deposited in the joints as well, where they would activate the complement system. The complement system would come and hit the synovial membrane of the joint, causing arthritis, causing inflammation, and that can lead to joint pain and joint swelling. So the clinical manifestations usually are seen predominantly in skin, in joints, in nerves, and in kidneys as well. Now, what are the diagnostic hallmarks of this condition? Remember, if any child who has got cutaneous vasculitic type of rash, he's got renal or joint involvement, and especially if there is a history of chronic infection. But even if there is no history of chronic infection and you have ruled out the common conditions, then you should be thinking of cryoglobulinemia. Now, the cryoglobulinemia, for that, the test is that you have to check for cryoglobulins. The cryoglobulins are those immunoglobulins in the blood that precipitate at the low temperature. So while taking blood from patients of cryoglobulin, it's very important that the blood is kept warm, because while in the transfer process, if the temperature of the sample drops, then you would not be able to check for these immunoglobulins because they would have already precipitated. So it's important to keep the sample warm at body temperature at 37 degrees Celsius, so that the cryoprecipitation is prevented and false negatives are avoided. Important thing, a supplementary evidence for cryoglobulinemia is the low C4 levels. Now the C4 is a complement, and why it is low? Because it is activated when cryoglobulins get precipitated. It would activate the C4. So C4 is consumed. When the C4 is consumed, it kicks in the inflammatory cascade and there's an inflammation. So the C4 levels would be low. If you have to differentially diagnose it from HSP, remember in HSP, C4 levels are normal because it's an IgA mediated vasculitis. This one is in cryoglobulinemia, you will see that the C4 levels are low. And sometimes you might see as supplementary evidence that the hepatitis C status is positive, either the chronic hepatitis or the hepatitis C antibodies or the hepatitis C PCR is positive in these cases. But remember, not only because of hepatitis C, sometimes trivial atypical infections like mycoplasma infection can also cause cryoglobulinemia. So you have to think about these things, and maybe you have to delve a bit deeper into the history to look for these things. Now coming down to the treatment. Now the treatment of cryoglobulinemia is the treatment of the underlying cause. So for example, if there are plasma cell dyscrasias, you have to treat for plasma cell dyscrasias. If there is an underlying hepatitis C, you have to treat them with antiviral medications to treat the hepatitis C. If there is an underlying hepatitis B, you have to treat the hepatitis B. If there is an underlying, let's say, atypical infection, you have to treat it with the appropriate antibiotics. If there is any other condition, like for example a malignancy or something, so you have to give appropriate chemotherapy for that sort of a malignancy. But in cases, let's say, where you cannot track the actual, or let's say the underlying condition cannot be treated, then sort of supportive management can also be done, because in hyperimmunoglobulinemia, especially in cryoglobulinemia, the blood viscosity is increased, so there are tendencies to sort of blood clotting in different ways. So it's important that these immunoglobulins are taken out of the blood. So that process in which we have to take that out is known as plasmapheresis. So where the immunoglobulin load is very high and there is a chance of a life-threatening condition, you can consider plasmapheresis. And then last but not the least, these patients have to be referred to the appropriate specialty. For example, if the kidney is involved, you have to refer them to the nephrologist. If the joints are involved, you have to refer them to the rheumatologist. If the nerves are involved, you might have to refer them to neurologist, and so on and so forth. So the key takeaways is that you have to treat the underlying condition, and if the underlying condition cannot be treated, then you have to treat the patient symptomatically or decrease the chance of precipitation by offering them plasmapheresis, or sometimes you can offer them steroids, or you have to refer them to the concerned specialties to get appropriate treatment. So this in a nutshell was cryoglobulinemia, which can take you by surprise. Remember, if a child presents, the takeaways, if a child presents with or sort of a vasculitic rash, painful tender rash, and there is a history of, let's say, joint pains, and the initial investigations are not pointing into any direction, especially given the fact if the child has got a history of hepatitis B or C or any other like chronic conditions, then you should be thinking of cryoglobulinemia. And important in that is that if you are taking blood, especially for checking for immunoglobulins or cryoglobulins, you have to make sure that the sample is kept warm at body temperature, and that is 37 degrees Celsius. So I hope you have learned something from this lecture regarding cryoglobulinemia. If you got any questions, you can put it down in the comment section below, and I'll be more than happy to answer those questions. Thank you. Take care and bye-bye.